This is NDTV, and you're watching NDTV 24/7.
Hello and welcome to Your Questions on Coronavirus. This is where we take your questions to our medical experts. We also talk about the latest medical breakthroughs and developments in the world's battle against COVID-19. Well, today is a particularly important day as large parts of India see significant easing of curbs and restrictions. A lot of you have questions on how we're now going to move ahead and enter a period where we will be living with the COVID-19 virus. What is that going to mean in terms of the precautions we'll have to take? What about the people who are now going to enter our homes? Remember, self-employed people, domestic helps, plumbers, electricians now can come to your homes again. People are rejoining the workforce as well. Most private offices will see 33% strength coming back to workforces. There will be more cars on the road, more two-wheelers on the road. So how is this life going to be in the new normal when precautions still have to be followed? Well, we're sure you have lots of questions on all of that, and joining us to answer those questions today are Dr. Ashish Dengra, who's a diabetologist, diabetes, thyroid and obesity specialist, and the director of Mahi Diabetes Thyroid Care and Research Center in Jabalpur. We're also being joined by Dr. Sandeep Chopra, cardio and additional director cardiology at Fortis Hospital in Ludhiana. Thank you very much, doctors, for joining us today. So let me throw this open to you with that first question. For instance, people will now be entering our houses. It was restricted to just family, nobody coming in. Now there's going to be a little more easing of that. What about, for instance, those who are entering our homes now for the first time after 40 days, what should we be telling them? What are the precautions we need to take?
Yeah, very good question. Basically, we are opening the from after lockdown, some things have been opened by government. So basically, if the household mates and all those people who are entering our homes, we should first get their medical checkup done. We should get the medical certificate from some government doctor or some private doctor, whether they had some history of fever, dry cough or fatigue in the previous 1 month period, or they have some history of travel. That all things we have to check, and then only we can allow them to be in at home, because it can cause the transmission of infection to us, or if the family member any of the family member who has been in quarantine, they should recheck their blood tests, and then only they should allow the people coming to their home for work.
All right. I believe we have our first caller online with us. Sumit is calling us from Gurugram. Sumit, welcome to the show. What's your question?
Well, thanks a lot. I just want to start by saying thanks a lot for giving us this opportunity. My question is for the cardiologist on the panel today. My mother is 65-year-old and she went through an angioplasty with stents last year. Is there something that I need to worry about or take extra measures to protect her from coronavirus, doctor? Any special instructions for us, please?
So, Dr. Chopra, he's saying his mother is has had an angioplasty with stents. Yes. She's also elderly. So what specific precautions should he be thinking of for his mother?
Sure. So she comes in the vulnerable group. So these patients are at high risk of infection and high risk of complications, God forbid, if they contract the coronavirus. Mm-hmm. So the general precautions of social distancing and isolation, wearing a mask at all times, should be very strictly followed with her. Mm-hmm. The other issue with these patients who've had cardiac issues in the past is the medications. A lot of my patients skip their medicines, saying that the chemists were closed and the hospitals were not accessible. So all these patients who were on regular medications should make sure that they have a good stock at home and be in WhatsApp consultations or video consultations with their cardiologists, and make sure that the compliance of their medications is continued till they get proper access to the hospitals. So all emergency services are anyway open, but I think this is the basic norm to be followed now.
All right, Sarmeet is also calling us from Gurugram this morning. Sarmeet, go ahead.
Hi, good morning. So they're saying that the lockdown will open up eventually. I'm just trying to understand how should we protect our children, because if the second phase is supposed to be worse than the first, or the third, in fact, is also bad. Eventually, when the kids start going to school, how are we going to protect them? Is there something that we should start doing from now to boost immunity? Is there something that we should take care of? Because so I have a 3-year-old, and eventually, there are other kids also. So I'm trying to understand what to do for the children specifically.
All right, Dr. Dengra, would you like to take that? I mean, there's been so much talk about how this virus can affect people and come really in waves, as it were. We've seen the first wave of the virus. We've seen the lockdowns following that. Now we're seeing a phase of easing of restrictions, not just here, but worldwide. But we're still having to live. We're going to have to live with the virus till we have a vaccine or a cure.
Yeah, very valid and practical question. See, we have to live with corona for coming 6 months to 1 year until we have the vaccine. So you have to take all the basic precautions which we have been taught in this lockdown, that you have to keep distancing, you have to wear the mask, you have to sanitize your hands, but with now more precaution, because now the transmission phase may occur in the community very fast, because we will be moving out of our houses, and the patients who are in the prodromal phase or the incubation period, they may transmit the infection. So you have to maintain the basic things when you are out, and you have to keep watch. You should be vigilant in the stores also. You should go and buy the things and then sanitize your hands after coming back home. Keep your clothes outside. Whatever the slippers you are wearing, you keep it outside the home. We wash with soap water outside the home, and you directly take the bath when you come in your home, and wash your clothes immediately. So less and less contact with the metallic things, and you use your non-dominant hand for the opening of the doors, and you use your dominant hand for your normal work, because the fomite transmission occurs from the hands, and we usually touch our face, eyes and nose through the dominant hand. So it is better if you go out, and if you open the doors, you use your non-dominant hand more as compared to the dominant hand.
Dr. Chopra, I think the lady's question was also specifically on children and how to boost children's immunity for the time when they eventually go back to school. Anything that you would like to add on that?
So I think the immunity basically comes from the vaccine, which is still in the research phase. And the general measures for immunity boosting, for which we advise as pediatricians for a normal upbringing of a child, I think that's the norm now, and that should be strictly followed. Better nutrition. There are other parties which are advising ways to build up nutrition. I'm not an expert in that, but I think this lockdown was bound to open, and social distancing should be the new norm for everybody, because we should be aware that the virus transmits through droplet infection to the respiratory tract, and as long as we are taking care of that aspect, I think we should be safe.
All right. We do have another caller on the phone line. Dr. Gandhi is calling this morning from Amritsar. Dr. Gandhi, go ahead.
Good morning, Doctor. Actually, I just want to inquire that what all precautions we need to take in a dental setup while we are handling our cardiac patients.
Okay. So dental setup, because dentists, ophthalmologists, and ENT surgeons are the professions in the medical fraternity which are maximal risk, especially dentists, because of maximal aerosol production which you have during your dental procedures. So I think you need to be protected more with the proper PPE kits. Screen your patients. There is no increased risk of cardiac patients undergoing a dental procedure as long as they're asymptomatic. Take up procedures which are only emergency and the need are right now. Elective procedures, please postpone.
All right. Dr. Chopra, Dr. Dengra, we've also been talking this morning about how Gilead Labs, which makes the antiviral drug remdesivir, which has now been cleared for emergency use by the US Drug Administration, has said that vials of the drug will be available to doctors and patients by this week, in fact, and that the US government will now decide on who gets that, and it could be shipped to other countries also, depending on what the US government decides. This is, of course, a lot of people's hopes are being pegged on this. Is it still too premature, in your opinion, for that? I'd like to hear from both of you. Dr. Chopra, if you'd like to go first.
Sure. I think it's a little premature in the sense we've had a burst of chloroquine, hydroxychloroquine, a few weeks back, and one antibiotic, azithromycin, which helped as well. Controversial use of steroids. So there, yes, a new kid on the block, a new drug, showing promising results. But I think a very limited experience, I must say. The FDA has approved because the drug has shown a remarkable recovery in more severely infected patients. But I think it's still early days.
All right, Dr.
Yeah, see the results, what they have shown is if we compare the drug with the placebo, so placebo is giving 8% mortality benefit and remdesivir is giving only 10%. So still further studies are needed, but in the end stage patients in which we can't do anything, we can use this drug and can prevent the mortality. So definitely we need more studies, and if we at present we don't have any other drugs, but if it is showing some better results, then we can use in the serious critical patients.
Right. All right, we do have another caller with us. Javed is calling from Srinagar. Javed, welcome to the show. What's your question?
Morning, Ankita. Morning, doctors.
Good morning.
Go ahead. Do ask them your question.
Morning, Ankita. Morning, doctors.
Do ask your question, please.
My question to the doctors is that some 12 years ago I was operated for my left kidney, and the right one is already non-functioning. So as we know that the Ramadan is going on, the fasting is going on, and we need to keep our immune system strong. So as far as my case is concerned, only 70% of my kidney is functioning. Okay. So is it advisable to keep on fasting, or should I skip the fasting because keeping in view of the current scenario of this corona virus kind of pandemic?
Yeah, a very good question. And as a diabetologist also, we say that few categories of patients, they should not keep the Ramadan fast, like the kidney patients, those who are on dialysis. So definitely in your case, you should avoid it, or you maintain the proper hydration, proper diet control, and do your exercise regularly. So in my view, if your kidney functions are not proper, so you should avoid this fast. If you have kept 1 or 2 fast for your rituals, you can now skip it.
All right. Javed, we hope that answered your question quite categorically. Dr. Sandeep Chopra, while we wait for our next caller, let's also talk about, returning to the workplace. We've already had a mother talking about her concerns for children returning to school. That is still some time away. We don't know when that is going to happen, but it's not in the immediate future. But right now, from today, in a lot of offices across the country, at least 33% staff are coming back. That's private offices. Government offices will see more people coming. So in terms of organizations, do you believe that there should be established protocols in place? As individuals, what can employees do at this point?
Sure. If you've noticed in the hospitals, we have these thermal infrared scanners for temperature checking. I think that should be the norm again for all offices. Screen them for any symptoms of the coronavirus. And if they are present, I think those people should be best avoided joining work. And if you notice in the hospitals, we have sanitizers all over the place. So every 15 to 20 minutes, everybody should be sanitizing their hand with either alcohol-based sanitizers or with soap and water. And then 33% is a very good idea. So slowly and steadily build up the workforce. Maintain at least 2 meters distance, a 6-foot distance between 2 people, and wear masks even within your office premises. Central air conditioning is an issue with major offices. I think good ventilation, open windows is again might be difficult in the Indian summer scenario, but I think that is a good way to go.
Dr. Dengra, anything you'd like to add to that?
Yeah, exhaust fans should be installed now, because the virus can be there in the offices for a long time, and these are the reasons why the hospital ICU doctors are getting more viral load. So exhaust facility should also be taken care if the ACs are not being on, and you should make a checklist before your employees coming to your office. take his history through the checklist. You can mail the checklist that whether he has fever, cough, or in the preceding few weeks or months. Like this, you can prevent the entry of the high risk your workers.
All right. We have Mohit calling us from Delhi. Mohit, welcome to the show.
Yeah,
Your
hi.
question?
Yeah, my question is for Dr. Sandeep. I'm a high BP blood patient. So, like, I'm running out of my medications because of this lockdown. So, what precautions do I need to take because of lockdown? What's going to continue?
Sure. Right, like I said earlier in the show, make sure you stock up your medicines. If you're a blood pressure or a heart patient, you cannot run out of your medications no matter what. So I think the chemist shops and the hospitals are open, so make sure you access your medications well. And that is the only precaution. Do not even temporarily stop your medicine without your doctor's consent, even for a day.
Right. I think that's something we've heard doctors reiterating time and time again. Dr. Dengra, would you say that that is also true of for people with diabetes and other sort of permanent existing conditions like that those drugs have to be taken continuously, and that's something that has to be a priority? I mean, medicine shops are open, so therefore it shouldn't be that difficult to have access to medicines, life-saving drugs.
Yeah, even during the initial lockdown period, we got telephones from the patients that, doctor, we are not getting this insulin. So we ourselves have arranged for them. So you don't worry. The government is also having the toll-free numbers. You can call them. They can send it to your home if somebody is elderly patient who cannot go out. So you have to take the medicines regularly as per your doctor's advice, and you can telephonically contact your doctor, send them your sugar reports or blood pressure reports. They will adjust it on telephonic consultation also, or teleconsultation nowadays. So don't worry, we are with you.
Right. And teleconsultations have really been happening quite effectively in most places. There are apps now that help you deal with that also. So do use all those technologies that are now available as we adapt to our new normal also. We have a caller from Noida. Ankush is calling. Ankush, go ahead with your question.
Yeah, hi, good morning. Good morning, doctors. Good morning, Ankita.
Good morning.
Morning.
Thank you, NDTV, for giving us this opportunity to resolve all these general and indeed very important queries. But my query is, like, as we are moving into lockdown 3, and there will be more number of people who will be commuting and getting in contact with each other. But now still, even if we won't allow maids and electrician not to come into our houses, but still we need to go out to buy vegetables and other perishable things, for example, milk or bread. So the probability of getting infected from such things are also there. So how we can prevent ourselves from such a scenario?
Okay, fair enough. So, Dr. Chopra, I think I want to add to this question. At this point, I mean, we're obviously looking at, as you said, a 6-month to 1-year period at least, when we're going to be living with the virus. So, at what point do we stop taking these extreme precautions? The government has already allowed, given the go ahead to let people who are self-employed back into your homes or workspaces or whatever. But how cautious does one need to be? Because a lot of people at this point are saying, even if it's allowed, I don't necessarily want anyone to enter my home. Is that irrational at this point? Are there checks and balances that can be used and allow this kind of movement?
So 2 aspects to that question. One is allowing people in your home. I think one at a time with proper screening, with asymptomatic people coming in, should not be a problem. Because we have to start living soon. The other thing is it transmitted by inanimate objects? The main mode of transmission of the COVID-19 is through droplet infection to the respiratory tract. So things like newspapers, things like banknotes, fruits, vegetables, yes, the virus can stay there, can stay on plastic surfaces for up to 9 days. But again, hand sanitization, cleaning of your surfaces, good food hygiene, if you buy vegetables and fruits from outside, should be more than enough to control and eradicate the virus at your home level.
All right. I'm going to read out a question we have from a viewer in Aurangabad. Subhash called in with this question. He wants to know what norms he should follow to maintain oxygen levels in the body for diabetes. I'm not sure I understand that question, but perhaps you would, doctors.
See, basically, the oxygen level is checked by the SpO2 meter probe, and it should be at least above 90 or 93%. But in diabetics, you don't have to worry if you don't have any lung problem like asthma or COPD. By keeping your blood sugars under control, by keeping proper hydration, and maintaining the exercise and diet control, you can maintain your oxygen properly. If you have any breathlessness while walking or while rest, so you should consult the doctor immediately, and otherwise you don't have to worry about the oxygen. It is usually normal in our body. If you are diabetic also, if you are keeping your blood sugars under proper control, you are maintaining hydration, diet and exercise.
All right, I'm going to just take quick last comments from you, doctors. Dr. Chopra, if you'd like to go first, just one short message that you'd like all our viewers at this point to have now that we're entering this next phase.
Firstly, we should, as Indians, consider ourselves fortunate that the severity of the disease is much less compared to the Western world. Might be a younger population or the BCG vaccine that we've received earlier. Just stay safe, follow the simple norms of social distancing, wearing a mask, hand hygiene, and I think we'll all be safe in the months and years to come. So should not be a big problem as long as we are disciplined ourselves.
Right. Dr. Dengra?
Yeah, lockdown has taught us the self-control. So you should be in the same mode outside also for 1 or 2 years, because Corona is going to be with us for in the near future also. So you should keep social distancing, hand washing, sneezing in your elbow, bent of the elbow or in the tissues. And please go to your doctors with prior appointment or any other place where you require appointment.
Right.
Don't go without appointments to make the place more crowded. So you have to avoid the crowding. If necessary, then only you go out, and elderly people should avoid going out still. If you want something, you tell your youngers, they should go out and buy the things.
All right. Thank you very much indeed, Dr. Chopra, Dr. Dengra, for joining us this morning and answering all these questions. We'll continue to take your questions on coronavirus and life as we move on to this next phase. Thanks for watching.